Hi everyone, this is Dr. Shravan Kumar Chintala, consultant medical oncologist at Renova Cancer Center, Karkhana. Today we will be discussing regarding cervical cancer. Cervical cancer is the second leading cause of cancer-related deaths in women in India. As per the ICMR National Cancer Registry Project data, approximately 3.4 lakhs cases of cervical cancer were diagnosed in the year 2023, of which 77,000 people were died due to this dreadful cancer. Out of every 4 women dying all over the world because of the cervical cancer, one is from India. So this highlights the importance of cervical cancer incidence and mortality. Cervical cancer was mostly seen in the age group of 31 to 45 years of age, and patients as low as 21 years to patients as elderly as 70 years are also get affected with this cervical cancer. Coming to the risk factors for developing a cervical cancer. Cervical cancer was commonly seen in people who are infected persistently with HPV high risk subtype 16 and 18. Apart from smoking is also one of the contributing risk factor for the cervical cancer development. Cervical cancer was commonly seen in the low socioeconomic status group of people because of lack of access to healthcare and screening programs. Cervical cancer signs and symptoms. So most commonly cervical cancer presents with abnormal vaginal bleeding or vaginal discharge, pain or bleeding during sexual intercourse, post-coital bleeding, post-menopausal bleeding. These are the symptoms related to the cancer when it is limited to the cervix. When the cancer has spread to different adjacent organs, patient may manifest with lower abdominal pain or kidney or bladder related symptoms. When the cancer has spread to distant organs, patients may manifest with symptoms pertaining to the particular organ of spread. Regarding cervical cancer screening strategies, cervical cancer was screened with pap smear or HPV DNA testing. If the patient is between 21 to 29 years of age, pap smear has to be done every 3 yearly. If the patient is between, if the woman is between 30 to 65 years of age, HPV DNA testing has to be done every 5 yearly, or you can combine pap smear with HPV DNA testing every 5 yearly. If the patient, if the woman is more than 65 years and if the past 3 consecutive pap smears were negative, we can safely observe these patients without any screening modality for the patient for these women. So the treatment of cervical cancer depends on the stage of diagnosis. Please contact your near oncologist for further treatment details. Thank you.